Mr. Ranieri.
No timing? Okay. Well,
Yeah. Morning, Commissioners. First of all, thanks for having this meeting. It's definitely an opportunity to get some good information that we can bring back to our constituents and our clients at House of Hope. So a couple of things. I want to thank Commissioner Smith for those thoughtful comments about just continuing to do business as you do it and the economic value of that for the community. There's also a mental health value of that. As much as we can do to keep people in a routine through this, you know, in their whatever sense of normalcy we can help them to maintain, has tremendous value as well. So I just want to make that point. And the plan that Commissioner Campy laid out, I applaud you for that as well. I think that's definitely an opportunity just to help the public to understand sort of where they can get good information, because there's a lot of information out there, but it's not always good information. We're trying hard at House of Hope to be a clearinghouse for that as well to the people that we serve. So just knowing a little bit more about your areas of expertise is helpful to us as well. So a little bit about sort of the community and what we're seeing and where we're heading. What we're doing at House of Hope, you know, we don't really have a lot of comps for this, obviously, to model, but we're using hurricanes as a point for us to model some of what happens to our services in the aftermath of a disaster, sort of what's normal versus, you know, what happens after that incident. We've also gotten a lot of information from agencies like us that are in other parts of the country that are further along in the impact and the number of cases and things like that in their community. New Rochelle, if you've probably seen on the news, is my hometown, so I've had the chance to speak to a lot of people there and find out how government and nonprofits are working in concert, and it's valuable and it's making a huge difference just in the safety and well-being of that community, just to use that one example. So I'm thankful you're talking about doing all this, and you know, I want to make sure that you all know I'm a resource available for any questions or suggestions you may have in what we're doing. So back to the modeling, what we're doing at House of Hope, we're looking at it two ways: food and financial assistance. And we've taken sort of what we normally see over a couple of months for financial assistance requests, what happens in the aftermath of a storm, for example, for financial assistance requests, and then using really kind of the large surge in client interaction we've had with new clients over the last week or so, and especially over the last few days this week. We're kind of creating another tier. So, and I'm going to share that modeling with the county, with other nonprofits, the health department, everybody, because it's not information that's for me, it's information that's for us as a community to hopefully get our arms around this and do a lot of pre-planning and pre-preparation. And I'm sure Elizabeth will talk about that in her opportunity. So, you know, we're anticipating that we could see from really April, starting in April is when we'll start to see a lot of financial requests ramp up, just because people will start to feel those effects now. The restaurant industry, really all the hospitality industries, a lot of hourly people that are being sent home early or furloughed, you know, those people are going to feel it starting in April when they have to pay rent and pay utilities and pay other bills. So April, May, June, we would normally see, you know, probably about 1,000 requests for financial assistance over those months. We're anticipating we'll probably see about 4,000 or more requests for financial support through those months. And the challenge with all this, in addition to the volume, is the timing. We're entering summer, which historically all of those kinds of needs for food and financial support spike dramatically because of the seasonality of our economy. So factoring those variables into this, you know, we're looking at a substantial issue, which could be as much as, you know, $800,000 or more needed just to keep people in their homes, keep people safe, keep people with their lights turned on, with their insurance paid, with their car running. So this is a substantial burden. And obviously, I don't think any one agency, government, or nonprofit is equipped to handle in our community we're only going to be successful if we're working very cohesively with each other. You talked a little bit about health, and I would just put into your thought process, food is health and housing is health. It isn't just about your physical well-being and what your doctor tells you. Mental health is also a big part of this. So we have agencies, besides House of Hope, one thing that's nice is in the nonprofit world, I feel like we have a head start. We do a really good job already collaborating with each other and sharing resources with each other, working with your Health and Human Resources group, with the Veterans Administration. So we're already kind of doing that pretty well as a nonprofit division in Martin County, amongst each other and with our government. And we're going to have to elevate that, and communication is going to be a big part of that. On the food side, last year we did about 1 million pounds of food, just under that, with our 4 food pantries, but also we currently provide about 15 external locations, soup kitchens, small church pantries, things like that, with food at no cost so that they can be successful. Where we spike again with that in the summer. So we're kind of forecasting out our food needs, and what's typically in these months that we're entering, 800 or 80,000 to 100,000 pounds. We're anticipating we'll probably be somewhere around 150 to 170,000 pounds per month of food over the next several months, assuming we can get it and keep it flowing and get it out to people. Distribution is another challenge. Agencies like House of Hope, Lahia, the Salvation Army, those, the frontline people around feeding our lower income community. We all also get about 80% of our volunteerism from seniors, which are the highest risk, or one of the highest risk categories for this. So they're staying away in droves, as they should. We need them to stay home and be healthy and be safe until we get past this. But what we're really ending up with now is, in the nonprofit world, around basic needs, food, clothing, shelter, financial assistance, medical support, and mental health support. We're all trying to do a lot more with a lot less, both financial resources and people resources. So anything you all can do as a group to encourage agencies you work with, groups you're a part of, to find a place to volunteer. We're all doing the social distancing thing. At House of Hope, for example, to access food, it's curbside pickup. We've limited who comes into our building dramatically. It's really our staff and our volunteers. We're pre-packaging food. We're bringing it out. We're dropping it into the trunks of their cars, and they're being able to drive away with it. Most every soup kitchen that's open, that's staying open right now in Martin County, has taken that same approach. They're boxing meals. You pull up, they hand it to you, you drive away. So we're trying to minimize those opportunities and do all the things we're hearing and being advised to do from the CDC and the health department around distancing, and around proper and safe handling of our food products as well. So we're all doing that, but again, we're trying to do all of that with a lot less people. So even a small group of people to come to a place like House of Hope, for example, and box up food makes a difference, or go to a place like Lahia and maybe help them meal prep or package, box up all those meals. That's a piece to this that nobody ever had to do before, right? You just put out the buffet, they eat it, and they go home. Now they're having to package all of that. So we're all having to deal with needs where we need extra manpower, and we can use any support out there for that. Kids are home from school and parents are comfortable with that, to come in again in a safe, secure environment. Everybody's doing the same thing. We're making sure if someone looks like they're sick, they're going home. And I know every agency that we work with, we're all taking those same steps and following the same protocols. We're sanitizing the hell out of everything. Sorry I said that. Heck out of everything. We're doing all of those things to, minimize risk and still be able to be successful in administering the services that are critical for us to provide. I think Commissioner Campy touched on it. The challenge here is going to be the length of this. It's not like a hurricane where you have the week to prep, it hits, you got maybe a week aftermath, you get back to normal. This could be 6 months. We're looking at it in 3-month increments at House of Hope. for the next 3 months, what do we need to, to deliver a high level of service, people, resources, money, food, understanding who's open out there in the network that we can properly and safely refer clients to address other needs around physical health, mental health, all of that. And then we're going to evaluate what we think is going to happen in the next 3 months. And unfortunately, this is going to be something that I think will be years before we have a full recovery to get back to where we were as a community. This is happening in key seasons, so everybody, for-profit and nonprofit, is losing out on a substantial chunk of the revenue that generally carries us through the summer. Whether you're for-profit or a nonprofit business, I think that's factual. We've canceled events. We're seeing a lot of our funders, because of what's happening on Wall Street, have to draw back a little bit at a time when we can really use a little bit of extra financial support. So these things are all real, and the business community is going to feel them the same effects. So that just magnifies sort of the number of people that are going to need assistance in some way, shape, or form. And just to give you kind of a view of what those numbers look like, on a regular day in Martin County, we've got about 17,000 people living at or below the poverty level. We have roughly about another 20,000 people that are in that food insecure situation where, statistically speaking, and this is a nationwide stat, about 40% of the country could not withstand one unexpected expense of $400 over the course of a month. So we have another 20,000 or so people that fall into that category. So you're looking at 37,000, roughly a quarter of our population, that before this crisis is financially insecure, basically, and food insecure. The numbers are going to magnify based on this, and the number of people that are already out of work or being furloughed and all of that. So, the impact on this is huge. It's not something we've ever experienced. What House of Hope and every agency that we work with in the nonprofit side has pledged to do is, as long as it's responsible and safe, we're going to man our posts and do what we do. We certainly need help to do that. Again, people, food, financial, we need help to do that. But that's our goal, that's our intent. We want to be there at a point when the community is probably going to need us at a level that we've never seen and experienced before. Just to give you an example, yesterday morning in one of our branches, we had a line of 15 new clients wanting to sign up. That's usually what we would see in that branch in a week. We had it in an hour. So, and we're at the beginning stages of this. So I don't want to sound like an alarmist, but it is alarming. And I think we have to prepare for it and be realistic. And if we overshoot and we overprepare, good for us. But if we underprepare, we make recovery that much harder. And statistically speaking, one of the things that I think we do well at House of Hope is homeless prevention. And we're going to be tested on that like never before as a part of this process. But the reason that that's so important is it is so hard to get somebody out of homelessness. The resources, financial, medical, mental health that go into getting someone back, pulling someone back in from that are tremendous. If we can prevent it, there's value in that on every level for the family, for the community, for law enforcement. I mean, the impact's just, it's the ripple effect. It just goes out. So, these are all things I think we need to consider. Virtual school, I understand where we are, for health and all that, but there's pieces of that. Now you got 18,000 kids that would normally be in a structured, safe environment that are not in a structured and safe environment, right? So the reason that the Boys and Girls Clubs and places like that are so important to every community that they're in is because, statistically speaking, when kids have that downtime, they're 200% more likely to be either commit a crime or be the victim of a crime. So that levels a whole other piece into this. I think Ms. Krista mentioned about more patrols at the beach. If we're going to have all those kids at home, we need more patrols in the neighborhoods. I don't know how law enforcement's going to be able to do the things they need to do. So there's a lot of pieces to this. It would be great if there was some kind of an opportunity with maybe a leadership piece from the commission, from law enforcement, some of the key nonprofits that are involved in this sector, some of the key mental and physical health agencies. If there was a way, it doesn't have to be face-to-face, whatever, a text group, an email group, some way to keep us all connected and constantly sharing information. And that part is important too, because this is shifting hourly. It's not even something daily. I've been at other meetings where they're saying we'll reevaluate in 2 weeks or 3 weeks. We're reevaluating at House of Hope 3 or 4 times a day based on new information and trends that we're getting and seeing in other parts of the country that are further along with this. So I know I kind of threw a lot out. The one other thing I'd like to say, you were all talking about different tips and ways to sort of help each other. An important piece of this, when we talk about our senior population, so I'll use House of Hope as an example because I live that example. A lot of our seniors that come into House of Hope for food, they can come in every day to get fresh fruits and vegetables. And anyone can, because we're really pushing that aspect. Our seniors, they come, they grab a couple of apples. They're not there for the apples. They're there because our staff and our volunteers are wonderful, compassionate, caring people, and it gets that senior out of the house and it gives them somewhere to go and somebody to talk to for 20 or 30 minutes. They go to the soup kitchens at night for the same reason. Maybe they need the meal, maybe they don't. They need the fellowship. So, this time is going to be very challenging, I think, for our senior population on a lot of levels. If you got a friend, if you got a neighbor, if you got somebody that lives down the street that falls into that category and they live alone, obviously you can't go sit there and have tea with them, but pick up the telephone. Don't email them, don't text them. Pick up the phone, let them hear your voice, let them feel reassured, from you, and spread that word amongst your constituents, your friends, your neighbors, and hear their voice. So if you can hear their anxiety or their fear in their voice and try to, mitigate that. The mental health aspect of this, I think, is something that we're not talking about enough right now. The schools, we need them to think about it going forward as well. So again, I know I threw out a lot, and I appreciate the opportunity to do that, and I'm happy to take any questions if you have them.
Any questions for Rob?
I do. You're here, Rob, from House of Hope, but I know there are so many nonprofits like you. How are you all communicating together so that, you're providing the unmet needs without duplicating them? So if the school district is providing meals and somebody's eligible for a school district meal, then they may not have to stretch your resources at that time. How are you all sharing that information, and how could the county be helpful?
So the agencies that work around feeding, we naturally communicate because we already share resources. When I get, a whole bunch of peppers, everybody gets a whole bunch of peppers, things like that. So the school district's piece, it's really continuity. They're trying to keep in place what they historically do. And even in the summer, they do a really great job of that with their summer feeding program. So those meals are kind of already part of our food feeding network, if you will. So that's not an extra, it's really a continuance. So we haven't really thought about, do we have to give somebody less or more because maybe their kids are getting some of those meals, because they would have gotten them anyway. What we're trying to do is make sure that all of the agencies around town that are smaller and cover the broader geographic segment of the community have what they need to function and be able to give people food who might be transportation challenged, and so they can only get to that little church pantry or whatever it might be. So, and that we do well all year long. We're heightening our communication, obviously, but we're following a lot of the same process and protocol. Like Lahia was at House of Hope yesterday getting supplies so they can continue, things like that. So we'll continue doing all of those things and following the same procedures around safety and food handling and availability.
Okay, thank you, Rob.
Rob, Michelle wants to say something, but in the meantime, you can wipe the microphone off of the next person.